Okay, we'll go ahead and finish up with the diuretics for the renal system. So we're going to talk about the potassium-sparing diuretics. And what do we know about aldosterone? We talked a lot about it. It promotes sodium uptake and excretes potassium. Because this is an aldosterone antagonist, it will retain potassium and excrete sodium. Does that make sense? Again, we know that aldosterone promotes sodium uptake and excretes potassium. Because this is an aldosterone antagonist, so it's going to antagonize aldosterone. It will retain potassium and excrete sodium. So it's the opposite. And so how this works, it produces a modest increase in urine production, and they produce a decrease in potassium excretion, rarely used alone to produce diuresis. Because of their ability to reduce potassium loss, they may be used to counteract a thiazide or a loop diuretic. So one of the most common one used for aldosterone antagonists would be spironolactone. It blocks the action of aldosterone in the distal nephron, used for hypertension and edema, because we don't want to hold on to sodium, which is going to hold on to the water because of hypertension. So usually it's used with a thiazide or a loop diuretic, mainly to counteract the loss of potassium with these other drugs. Adverse effect of this one is going to be hyperkalemia, because just in the name itself, it says potassium-sparing diuretic. And then also another one would be our non-aldosterone antagonist, so something that's not aldosterone related. We have our triamterene. It disrupts the sodium-potassium exchange in the distal nephron. Unlike spironolactone, which blocks aldosterone, triamterene is a direct inhibitor of the exchange mechanism between the sodium and potassium. Because it does this directly, it acts much quicker than spironolactone. Used for hypertension and edema, causes mild diuresis. When used with other diuretics, thiazides and loop, it counteracts potassium loss. Adverse effect, again, is going to be hyperkalemia, because we're using this with the thiazide and the loop because we know we're going to be causing hypokalemia. But then, every adverse effect is what can it do too much of. And then our last diuretic to talk about is our osmotic diuretic, the only one really in its class, and the most important one for years is called mannitol. Only given IV, is freely filtered right at the glomerulus, undergoes minimal tubular reabsorption, undergoes minimal metabolism, is pharmacologically inert. What that means, it has no direct effects on the biochemistry or physiology of the cells. So how does it work? If filtered by the glomerulus as a result of minimal reabsorption, most of the filtered drug remains in the nephron, creating an osmotic force that inhibits passive reabsorption of water. So urine flow increases. The degree of diuresis produced is directly related to the concentration of mannitol in the filtrate. The more mannitol present, the greater the diuresis. So basically, what do they use this for? And as you can read here, mannitol has no significant effect on the excretion of potassium or other electrolytes because it is, again, pharmacologically inert. It's used for that's not supposed to say poor, it's prophylaxis of renal failure, reduction of intracranial pressure, and reduction of intraocular pressure. So a lot of nurses in the ICU use this one. It's basically to pull water off the brain or to minimize any destruction in the brain by keeping it very, very quiet and reducing intracranial pressure and intraocular pressure. And in relation to prophylaxis of renal failure, it's because the filtered mannitol remains in the nephron, it draws water to it, so it preserves urine flow and thereby prevents kidney failure. And then intracranial pressure, its presence in the vessels of the brain causes an osmotic force that draws edematous fluid from the brain into the blood. And it draws ocular fluid into the blood, creates an osmotic force, hence the name osmotic diuretic. So if you do need it, most of those are usually for head traumas. Very, very important drug to be using for that. And that'll be the end of our discussion for the kidney drugs. Not that many. You just have to know the different groups of diuretics.